Yamaguchi syndrome, or apical hypertrophic cardiomyopathy. We have two forms of HCM, the obstructive form and the non-obstructive form. Yamaguchi syndrome is a non-obstructive form of HCM, which is a relatively uncommon form that is seen most frequently in Japanese patients, for about 13 to 25% of all HCM cases in Japan. It's known as Yamaguchi syndrome after the Hiroshi Yamaguchi and his original papers on hypertrophic non-obstructive cardiomyopathy with the giant negative G waves observed on ECG in the 19s. So for clinical diagnosis of Yamaguchi syndrome, we have a pathognomonic feature of it, which is known as Ace of Spades sign, with a marked ventricular wall thickening at the apex, resulting in a cavity narrowing at the apex, with a relatively normal appearance of the midventricular to basal wall and cavity. And this sign, it can be demonstrated on echocardiography, ventriculography, and cardiac MRI, as you can see on the pictures. So, for apical HCM is thought to be an autosomal dominant pathology due to some gene mutations which occur in myosin-binding protein C and myosin heavy chain. Isolated hypertrophy of the left ventricular apical region rather than the left ventricular septum characterizes this condition, but frequently it's misdiagnosed as an acute coronary syndrome due to the presentation of the patients, resulting in delayed diagnosis. Patients presenting with chest discomfort, palpitation, dyspnea, syncope in some cases, and heart failure symptoms are a few of the clinical symptoms which are presented in this condition. And of course, it can develop into some complications, including myocardial infarction, arrhythmias like atrial fibrillation, ventricular fibrillation, embolic events, and/or congestive heart failure symptoms, which is decompensated later if it's complicated. And apical wall motion anomalies like hypokinesis and aneurysm developments can be present as well. Now moving to the ECG. So here we have a classical ECG in apical HCM with a presence of a giant G-wave inversions in the precordial leads, as you can see here in V3, V4, V5, and V6. And inverted G waves are also commonly observed in the inferior and lateral leads, as present here in the ECG, with lead 2, lead AVL, AVF, and lead 1. When coming to the treatment of our Yamaguchi syndrome, it focuses on managing the symptoms and preventing complications throughout medications, lifestyle adjustments, and medical devices. So medications, we can use beta blockers, calcium channel blockers to control heart rate. ACE inhibitors can be used as well to reduce strain on the heart, and an antiarrhythmic, disopyramide, can be used in some cases as well. Lifestyle changes, such as recommending the patients to not do some vigorous exercises and do regular mild to moderate exercise, avoiding dehydration or extreme temperatures, are also recommended. An ICD implantation may be necessary for high-risk patients, especially for patients who developed already some arrhythmia as a complication of this condition. And first-degree relatives, they should be screened with genetic testing and echocardiography. That's all. Thank you for watching.